Let me know when we're live. Live, ready to go?
Mm-hmm.
Hey, what's up, guys? So most of you guys all know me, Paul Kolaski down here at Vallejo Physical Therapy. Gonna talk to you real quick about a popliteal release. So you guys are asking about a fast-acting knee technique or knee pain technique. What I like about the popliteal release. A couple big things about it. Muscle that starts on the inside of the tibia, crosses over and attaches to the femur on the opposite side of the knee. A lot of research shows that that particular muscle gets highly spasmed or contracted, especially after surgery. So all your total knees, anybody that's had a total knee, anybody that's had any type of ACL repair or any other knee trauma, this muscle will spasm in a response to the quad being turned off. All right. If that happens, then as a person bends the knee, and this is one of the magic techniques we use, as they go to bend the knee, that medial joint line is going to overcompress, and these guys are going to get a lot of pain on the inside of the knee. So one way to work on that is lacrosse ball or fingers doing a quick pressure point release. So to find that we don't have any shorts on today, but hey, find that tibial plateau. You're going to roll to the inside, just to the medial side of the tibia, coming off of that tibial plateau. And if you guys look this up on an anatomy book, you'll see it attaches here at the top, and then it comes down about 2.5, 3 inches, and then it fans. It'll fan this direction. Okay, so it basically forms a triangle coming over this way. So we've got great access to that muscle right here in this position. And so we just use the lacrosse ball right here in this position. We let the client do it. All right, so they put their own pressure on it. Excuse me, guys, got a ton of sinuses going on down here in Texas. So I let them do that. They're gonna move it around, 60 seconds to 90 seconds. Pressure here should not cause them to react or respond. Okay, so that's when you think about a scale of 0 to 10, 5 you need medication. This needs to be a 3/10 or less. They're not holding their breath, they're not wincing, you're not getting a positive facial sign, nothing crazy like that. So for me, when I release a muscle, I turn a muscle up. So say she's done, then she would go into, we know that this muscle is going to be in a direct response to the quad. She'll take this leg out straight, do some simple quad sets, all right, initially, and then we could take her to some straight leg raises after that. Have her jump up. You could retest flexion afterwards. I guarantee you guys, you're gonna get a good 10, 15, 20 degrees increased in knee flexion, all right, if they're really restricted post-surgical. They stand up, do a functional squat, single leg, double leg, their knee pain is going to be improved. You got any questions, just shoot me back in the comments. Talk to you later. Good luck.